Knock knock. Hi, my name is Savannah Gregory and I'm going to be the nurse practitioner taking care of you today. Can you tell me your name and date of birth?
Todd Gregory, May 13th, 1996.
And what brings you into the clinic today?
Nasal congestion that I've had for a while.
How long has this congestion been going on for?
About 2 weeks now.
Is it just your nose or is it in your head?
Nope, just my nose pretty much.
And how long has it been going on for?
About 2 weeks now.
Has it gotten worse over the 2 weeks?
It hasn't really got worse, it's just been consistent.
Have you had a runny nose with that?
A little bit.
Any color change? Is it clear, yellow, green?
It's pretty much been clear.
Been clear? Okay. Have you had a headache with this congestion?
Occasionally.
Is it pressure, pounding? Explain that headache for me.
It just feels like a sinus infection type pressure.
Okay. Is there a time when your symptoms have gotten better or worse?
Normally during the day is when everything's better. When I wake up in the morning and go to sleep, it's normally when it's worse.
Have you taken anything for your symptoms yet?
I've taken Tylenol, cold and sinus, and nasal spray.
Did that medicine help any?
The Tylenol, cold and sinus did not. The nasal spray did help.
Did it help with the congestion and runny nose?
No.
Do you have any medical history?
I have Meniere's disease.
Okay. Have you had any surgeries?
I've had right elbow reconstruction.
And are you up to date on all your vaccinations and immunizations?
Yes, I am.
What medical history does your mother have?
She had breast cancer.
And what about your dad?
Hypertension and
It's okay if you can't remember.
I believe he had hypertension and what is that with your blood sugar?
Diabetes?
Yes.
Okay. What about your grandmother on your mom's side? Does she have any medical history?
I'm not aware of any that she's had.
What about your grandfather on your mom's side?
I'm not aware of any that he had either.
What about any medical history on that your grandma has on your dad's side?
She's passed away.
What about your grandfather on your dad's side?
He's passed away as well.
Do you have any siblings?
Yes, but they're both healthy.
Do you have any allergies to any medicine?
I do not.
Do you have any allergies to any environmental or food allergies?
I do not.
Do you drink?
2 to 3 beers a week occasionally.
Do you smoke?
I do not.
Any chewing tobacco or vaping?
I do not.
Any cool drugs like cocaine, meth, marijuana?
No, ma'am.
Now that we know about your medical history and allergies, do you take any medications daily that are prescribed to you?
I take something for the Meniere's disease, but I'm not sure the name of it.
Okay, it's really important that you know what medicines you take daily. That way, if you ever come to the doctor's office, then you can know about your medical history. And you need to know what medicine you take, how often you take it, and what the milligrams of it that you take, okay? So now I'm just going to ask you some general questions, okay?
All right.
Have you had any unexplained weight loss, weight gain, or fevers or body aches?
No.
Have you been around anyone sick?
No.
Notice any bruising, rashes, or discoloration anywhere on your skin?
No.
Other than your headaches, have you had any head injuries?
No.
No. Any vision changes like blurred vision, double vision?
No.
Any redness or itching in your eyes?
No.
Any drainage?
No, ma'am.
Any ringing from your ear or drainage from your ear?
No, ma'am.
Any pain coming from your ear?
No.
No. Tell me about your nasal congestion a little more. I know you said it was stuffy in the morning with no color drainage.
No.
No bloody
It's been clear.
nose, no pain, no itching, no dryness.
No, ma'am.
No, okay. Any changes in your smell or taste?
Not that I've noticed.
Any hoarseness in your throat that you can tell?
Occasionally, but not really.
Okay. Any sore throat or ulcers in your mouth?
No, ma'am.
No. Any pain in your neck, difficulty swallowing or swelling that you've noticed?
No.
No. Any lumps, masses in your breast?
No.
Any shortness of breath, cough, or blue lips?
No.
Any chest pain? Palpitations, anything like that?
No.
Have you had any nausea, vomiting, diarrhea?
No.
Any blood in your stool?
No.
When was your last bowel movement?
This morning.
And was it normal for
Yes.
you? Okay. Any frequency in urination? Any dribbling or incontinence?
Just normal.
Good. Any changes in your arms, like range of motion? You're able to move everything normal still without any pain, no swelling? Any joint pain?
No.
Any weakness on one side of your body?
No.
Any trouble speaking or forming words?
Nope.
Any dizziness?
Nope.
Any feelings of hopelessness or depression?
No.
Any thoughts of harming yourself or anyone else?
Nope.
Are you seeing or hearing anything?
No.
Have you noticed any abnormal bleeding or bruising anywhere on your body?
Nothing I've noticed.
That's awesome. We're going to get to ask you a few more questions. I'm going to start my assessment. I'm going to assess your head, ears, eyes, nose, and throat, okay?
Okay.
First, I'm going to touch your head. Let me know if you have any pain or tenderness when I feel your head. Any pain?
No.
Head is symmetrical and midline. No deformity is noted. Hair is evenly distributed throughout the head. Hair color is the same throughout. Hair is not brittle or dry. No masses or tenderness. Skin is warm, dry, and appropriate for ethnicity. There's no discoloration, bruising, or edema noted. All right. Any pain or tenderness when I feel on your temporal arteries?
No.
How about when I touch your sinuses? Any pain?
No.
No? How about when I tap? Any pain or tenderness?
No.
No pain or tenderness noted. On palpation or percussion to the frontal or maxillary sinuses. So next, I'm going to feel your lymph nodes, okay? We're going to go preauricular, postauricular, occipital, tonsillar, submandibular, submental, anterior cervical, posterior cervical, and supraclavicular. Any pain or tenderness?
No.
So lymph nodes are not enlarged, non-tender, or warmth when palpated. So next, I want you to clench down your jaw for me. Clench really hard. Perfect. Any pain with that?
No.
So patient is able to clench down jaw with no problems. Next, I need you to close your eyes and let me know if this feels, how this feels. If it's sharp or dull, okay? How does that feel?
Dull.
How does that feel?
Dull.
How does this feel?
Sharp.
How does this feel?
Sharp.
Okay, perfect. Now, tell me if this is light. Does it feel light or heavy?
Light.
And does it feel the same on both sides? So next, I'm going to use my pen light, okay? And just stare at the wall, and I'll tell you when to look, okay?
All right.
Perfect. The corneal reflex is present. Cranial nerve 5, trigeminal nerve V1, V2, V3 are intact. All right, next, can you smile for me? Say cheese. Can you puff out your lips like this? Puff out your cheeks. Raise your eyebrows. And when I'm gonna take your glasses off, and I'm gonna try to lift up on your eyes and try not to let me lift up, okay? All right, perfect. And I'm gonna try to pull down. Don't let me lift down. Close your eyes and don't let me pull down. Perfect. So cranial nerve 7 is intact. His eyelashes and eyebrows and palpebral fissures are symmetrical and no discharge, redness, or swelling noted. You're just going to look in your eye again. You can open. The sclera is white and the conjunctiva is pink and moist. There's no discharge, lesions, or foreign bodies noted. So next I'm going to check your peripheral vision. What I want you to do is look straight at me, and when you can see my fingers, you just let me know, okay? You can leave your glasses on. Okay? Tell me when you can see my fingers.
I can see him.
Okay?
I can see him.
Perfect. So the next thing I would do is use a Snellen chart to test his vision, his central vision. But for the video, 20/60 vision means that this patient is able to see at 20 feet what a patient with great vision could see at 60 feet. So what I'm going to do next is I'm going to check your pupils with my pen light, okay? So just look straight at my nose. Great. Great. And just follow my pen all the way to your nose. Perfect. Pupils are equal and reactive to light, and the pupils accommodate. Cranial nerve 3, 4, and 6 are intact. The next thing I want you to do is just follow my finger, okay?
Mm-hmm.
Great. 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 I'm going to use this ophthalmoscope to look in your eyes, okay?
Mm-hmm.
Great. Now I'm going to come over here to this side. So the optic disc is rounded with smooth edges. It's yellowish in color, and the vessels are smooth, and the red light reflex is also present. So now that we've finished with the eye part of the exam, I'm going to assess your ears, okay? Can you look towards me? Great. The ears are symmetrical bilaterally. Great. The auricles are aligned and symmetrical. The mastoid area is symmetrical. There's no masses or lesions noted. So next I'm going to look in your ear, okay?
Mm-hmm.
I'm going to use the otoscope to look in your ear.
Mm-hmm.
Great. Can you turn your head towards me? Perfect. Great. So the auditory canal has no swelling, no redness or seronode that's blocking the tympanic membrane. The tympanic membrane is pearly gray. The cone light reflex is noted on the right side at 5 and on the left side at 7. There's no signs of rupture or drainage noted. Next, let me know if you have any pain or tenderness. Any pain or tenderness on this side? Any pain or tenderness on this ear? Great. So there's no pain or tenderness noted to the pinnae or tracheasis. So next thing I'm going to do is I'm going to check your hearing, okay? So when we do, I'm going to whisper something behind your ear, and you just let me know if you can hear it or not, okay?
Mm-hmm. 99. Baseball.
Perfect. The next thing I'm going to do, I have this tool here, and then we're going to do what's called the Weber's test. Mm-hmm. And basically, I'm going to put this tool on top of your head, and I need you to tell me if you can hear the noise in one ear or both ears. And if it's louder or one ear than the other, you just let me know. Okay?
Mm-hmm. It's going to be the same.
Does it feel the same? Can you hear it the same?
Mm-hmm.
Great. The next thing I'm going to do, the Weber's test was completed on the patient's report, and he reports it being able to hear the noise symmetrically in both ears, with one ear not being louder than the other. The next thing I'm going to do is I'm going to place the same tool behind your ear, okay? Mm-hmm. Let me know when you cannot hear the noise anymore, okay?
Mm-hmm. Can't hear it anymore.
Perfect. Now I'm going to put it in front of your ear, and you tell me if you can hear it. Tell me when you can't hear it anymore, okay?
Mm-hmm. Can't hear it anymore.
Great. So the Renee's test was completed, and air conduction was greater than bone conduction. So now that I've done assessing your ear, I'm going to assess your nose and mouth, okay? Mm-hmm. So his nose is midline and straight. There's no trauma or swelling noted. Look up for me. Great. Great. So the septum is midline, not deviated. The mucus is pink and moist. There's no swelling or redness noted. There is clear discharge though. Next, what I'm going to do is I'm going to plug one side of your nose like this, and then plug the other side. And you're just going to really hard for me, okay? Go ahead. Perfect. Great. So the nasal canal is patent. Next thing I'm going to do is I'm going to look in your mouth, okay? Just stick your tongue out for me. All the way, okay? Great. Great. So his lips, teeth, gum, mucus, hard palate, and soft palate, tongue, floor mouth, under his tongue, salivary ducts, and posterior pharynx are clean, pink, moist, no red, no swelling or edema, lesions noted. The dental hygiene is very well kept. All teeth are present. There's no changes in voice or difficulty swallowing. His tongue is midline without fasciculation. All right, next, stick out your tongue for me, all the way out. Move it from side to side, up and down. Perfect. Now I'm going to press on your cheek and you try to poke your tongue out and move my hand away. Great. Now this side. Great. So the tongue strength is strong and equal on both sides. Next thing, stick out your tongue and say ah. Ah. Great. The soft palate and uvula rises symmetrically. His gag reflex is also present. Cranial nerve 9 and 10 are intact. So now that I've checked your eyes, ears, nose, the next thing I'm going to do is check your neck and throat, okay? So his skin on his neck is appropriate for ethnicity. There's no discoloration, no edema, no bruising, scars, lesions, and the skin is warm and dry to touch. I'm going to feel for your trachea, okay? And swallow for me. Great. So the trachea is midline and not mobile. I'm going to feel for your thyroid next, okay? So lift your chin for me. Great. Now swallow. Great. So the thyroid on him is not palpable. Next, can you move your neck, head forward, back, side, side, and on a circular motion? Perfect. So when the patient does that, the range of motion is present with flexion, extension, hyperextension, lateral flexion, and rotation. He denies any pain or difficulties with range of motion in his neck. The last part of the exam, I need you to shrug your shoulders for me and try not to move my arms. Great. Now try not to move my hand when you tilt your head. Perfect. And last thing, great. So the cranial nerve 11 is intact. So now that I have completed your exam, my diagnosis for you are sinusitis, viral illness, or possibly just allergies, okay? So what I want you to do is go home, continue using your nasal spray. I'm going to write you a prescription for some allergy relief medicine, something like Claritin. If your symptoms continue after about 3 days of taking the medicine, I want you to come back and see us because we'll probably give you a dose of antibiotics then, okay? And if the antibiotics are given, we need to make sure you take every antibiotic as prescribed. Even if your symptoms start getting better, it's still important to take every antibiotic. That way you don't create resistance in the future to that antibiotic when you could possibly need it for something a little more serious. Do you have any questions or concerns about anything that I've done for you today?
I do not.
All right. Well, I hope you get your feeling better and you take care, okay?